Italian anti-vaxxers pay to socialize with COVID patients to get infected. In order to avoid vaccination, anti-vaxxers in Italy are paying $110 to dine and drink with persons who are COVID positive. As of February 1, Italy's new vaccination requirement demands that anybody over the age of 50 gets vaccinated. The unvaccinated might be fined or lose their employment if they don't get vaccinated. Due to the body's formation of antibodies during an infection, the only alternative to receiving the vaccination is recovery from COVID-19 infection, which is not an option under the mandate. People in Italy are resorting to extreme methods in order to avoid having their recovery from illness documented on their national health card. COVID parties were held soon after the mandate was announced, allowing individuals who had the virus to interact with those who wanted to get it in the hopes of helping them recover and obtaining the pass. A truffle supper with Barolo wine and a COVID-positive individual was part of one such gathering discovered in Tuscany. Participation in the event was priced at $110 per person. Italian infectious disease specialist Pier Luigi Lopalco suggested that COVID parties were illegal and that everyone engaging in them should be imprisoned when speaking on Italian television. Before the February deadline, Italian law enforcement is seeking to shut off illegal COVID gatherings and other schemes. It's not the first time that tales of COVID parties in Italy have surfaced. In November of last year, coronavirus parties in Italy led to the deaths of one person and the hospitalization of a number of others. Health officials said that a 55-year-old Austrian man died after being sick during a corona party in the northern Italian region of South Tyrol. There have been at least 3 further hospitalizations throughout the province, including a kid, after contracting the illness at similar events, including 2 who are now in critical condition. Health officials suspected that the persons were anti-vaxxers who wanted to get a green permit, a necessity for employment in Italy at the time, by being sick. The Italian police have also been investigating fraudulent health cards in many incidents, including one that made headlines when a dentist walked in for his vaccination with a silicone fake arm. Immediately after his arrest, the dentist claimed that he had received vaccinations and was challenging the government's vaccination requirements for healthcare employees. Also last week, a nurse in Italy was charged with faking coronavirus vaccinations for at least 45 individuals to get false health passes, throwing vaccines in the garbage and even dressing his patients in bandages to disguise the deception. Italy's eastern coast city of Ancona has also put 4 accused collaborators under home imprisonment for allegedly identifying anti-vaccine consumers prepared to pay for a health pass rather than obtain the vaccines. In a police statement, it was said that 45 persons who were reportedly scammed into receiving the permits are now being investigated, are forced to check in daily with authorities, and are prohibited from leaving their localities. It was caught on camera that an Italian nurse was pretending to inject her patient with an injection and then covering it up with bandages. The footage was taken in Ancona, Italy, which is a major vaccination distribution center. In addition to corruption, falsification of facts, and theft, the phony vaccination plan squandered a basic public resource, according to the police. Unvaccinated people in Italy are progressively restricted from participating in a variety of activities and services, including public transportation, without confirmation of vaccination or recent COVID-19 recovery. An increasing number of Italians are returning to work and school after Christmas and New Year's, and the number of new COVID-19 infections in Italy is approaching 100,000 per day, prompting the government to introduce the super health pass requirement. The government has reacted to the Omicron-fueled illness surge by imposing additional restrictions designed to force vaccine unvaccinated people to get their shots or face being barred from recreational and even vital activities like riding the bus or metro to work. A common health permit and outdoor mask requirements have been widely accepted by Italians in recent months, as well as other limitations. Less protective FFP2 face masks are now needed on public transportation. A backlash has been directed at Prime Minister Mario Draghi after the announcement last week that vaccines will be made mandatory for those 50 and older. For non-compliance, a punishment of €100, $113, is considered too low by critics. However, if workers in this age bracket are still not protected by mid-February, the penalty will soar to as much as €1,600, almost $1,800. Draghi defended the vaccination mandate during a press conference on Monday. There have been concerns raised by medical professionals that the sudden influx of COVID-19 patients may leave hospitals unable to perform routine procedures or provide adequate treatment to patients who do not have the disease. A total of 86% of Italy's 12 and over population has been vaccinated against the coronavirus, and approximately 75% of those eligible have gotten a booster. However, just 2 million of Italy's 60 million people are now positive, which has a direct effect on crucial services. As a result of the high number of teachers who are either positive for the virus or in quarantine, numerous school districts have expressed concern about reopening. Sicily and Campania, which includes Naples, in the south of Italy, disobeyed the government on Monday by keeping their schools closed. However, when a parent filed a judicial appeal to the shutdown, Campania's schools were forced to resume on Tuesday. By closing schools during the first year of the epidemic, the previous administration had taken a stand against democracy, according to Draghi. After school, they hang out at pizzerias and play sports all day, said the Prime. Closing schools while leaving the rest of society open makes no sense. According to Education Minister Patrizio Bianchi, almost all of Italy's teachers have been vaccinated against measles, mumps and rubella. On Monday, Italy's health ministry recorded 101,762 new COVID-19 cases versus 155,659 the day before, while coronavirus-related mortality increased to 227 daily from 157. 139,265 people have died and 7.55 million have been infected since the epidemic began in February 2020.